Hello, I'm Dr. Joan Lacomis, and I'm the Director of the Fellowship Cardiothoracic Imaging at UPMC. Cardiothoracic imaging is a truly exciting field to go into. Right now, when people are looking for jobs, cardiothoracic radiologists are highly sought after. And most fellows have jobs even before they've started fellowship, just knowing that they're going to be doing a fellowship. We have a unique opportunity here in that we have some flexibility in our fellowship. Fellows can choose to do purely thoracic imaging, or they can do thoracic combined with cardiac imaging. Even within cardiac imaging, they can subdivide and focus purely on cardiac CT, or cardiac CT and cardiac MRI. There are many opportunities to diversify during your fellowship. We let people have the choice if they want to do pure thoracic imaging or combined thoracic and cardiac imaging, and even in that, we have a division in cardiac imaging if you want to learn cardiac CT or learn cardiac CT and cardiac MR. For thoracic imaging, we have an extremely busy service. We have a very active lung transplant service, very active esophageal surgeons. We have Hillman Cancer Center with all of the oncology cases, and a very active interstitial lung disease clinic. We also are one of the leaders in doing lung cancer screening in Pennsylvania, and in fact our beloved Dr. Furman, who recently passed away, was one of the leaders in getting lung cancer screening going in the US. Our fellows can basically tackle anything in chest when they leave here. We've had a number of our attendings have done fellowships in other strong programs in the US, and they come here and they can't believe the number of cases they get to see and the variety. For cardiac imaging, that's something I'm particularly proud of. I started cardiac imaging at UPMC many years ago, and for years we've been a leader in collaborative imaging with cardiology. It's something that we're quite proud of. Our fellows and our residents get to take advantage of that. We have a joint service for both cardiac CT and cardiac MRI. In cardiac MRI, we have a huge hypertrophic cardiomyopathy clinic. We have a very active heart failure clinic, and we typically do between 7 and 10 cardiac MRIs every day. We do stress imaging in the magnet, and really people get a huge variety of things to see, and we're often working side by side with the cardiologists, and the cardiologists get to teach the radiologists, and the radiologists get to teach the cardiologists. So, and for the fellows, some days they have an attending that's a cardiologist, and some days they have an attending that's a radiologist. So it really gives a huge depth of experience. We do a lot of coronary CT on a daily basis. We also do some congenital heart disease imaging in the adult congenital heart disease population. We do a lot of structural heart disease imaging, very active TAVR program. We were one of the initial sites involved in the original core valve trials, and we have a very active atrial fibrillation arrhythmia center. So we do a lot of left atrial appendage, LAA occluder imaging. Again, it's something that's pretty exciting for us because we are, again, very collaborative with cardiology doing that. They rely on us for the CT, and we've done it for a number of years. We have a number of attendings, not just 1 or 2 attendings. We're able to accommodate usually about 3 fellows per year, and people really get a phenomenal experience in cardiac in general. So if you're interested in the program, come see us, and we would love to give you more information.